Hi, I'm Carolyn. I'm one of the nurses in the chemotherapy department. Today we're going to talk about chemotherapy and how it'll affect you with some of the signs and symptoms that you may experience. If you have any questions, we can answer them at the end of this. Thank you. I'm going to talk now about chemotherapy. When you come to the clinic, you will receive the chemotherapy either in an intravenous or under the skin, depending on what the doctor has told you how you will receive your chemotherapy. Chemotherapy not only hits the cancer cells, unfortunately it hits the normal rapidly dividing cells in your body. So some of the side effects that you can have are nausea, vomiting, constipation, diarrhea. I will address these side effects in the class in more detail. So chemotherapy affects your blood cells, which are produced in the bone marrow. The blood cells that are affected are your white blood cells. That's for infection. Signs of infection are fever, temperature of 38, you'll call us, coughing up yellow, or having urinary symptoms, difficulty urinating, cloudy urine. Those are signs of urinary infections, and that's what you would call us about. White blood cells are at their lowest 7 to 14 days after treatment, so that's when you're the most prone to infection. So you have to be very careful when you're 7 to 14 days after your treatment. Hand sterilizer is usually what we recommend you use for infection. Just make sure you wash your hands frequently. Chemotherapy also affects the red blood cells. Red blood cells carry oxygen, so unfortunately you will be a little tired after your treatment. Signs of low red blood cells: if you are fatigued, if you are short of breath, chest pain. Obviously with chest pain you'll call 911. Blood in your stool, blood in your urine, those are signs of low red blood cells. Chemotherapy also affects your platelets, so you're a little bit more prone to bleeding than normal. So you may bruise a little easier, you may have some red marks on your skin. That's from low platelets, and you'll call us about that. We also recommend when you're getting chemotherapy to have a soft toothbrush. That will help with decreased bleeding. Also dental floss, when you're flossing, if you're having a lot of bleeding with flossing, we recommend that you be a little bit more gentler with the flossing or just avoid the flossing. One of the side effects that's probably the most common side effect is tiredness, and that's a result of your red blood cells being low, and red blood cells carry oxygen. So what we'd like you to do is we want you to balance rest with activity. So do things very, very slowly, pace yourself. Try to get about 8 hours of sleep a night. If you are having trouble sleeping, then you will call us and we can have a sleeping pill ordered for you. Drinking a little more fluid can help with you being tired. We'd like you to drink 8 to 10 glasses of fluid a day. That does not include coffee and tea, because coffee and tea are diuretics. So juices and water is good, 8 to 10 glasses. If you are extremely tired, we'd like you to call your doctor or call the clinic. Exercise is very important. It also helps with fatigue. Sometimes when you sit in a chair for 8 hours and you're not moving, you're very, very fatigued. If you get up every hour or so and walk a little bit for about a minute or two in your room and sit down, and then every hour again get up and walk around, that tends to decrease the fatigue a little bit. Another side effect for chemotherapy is nausea and vomiting. So when you are nauseated, we want you to take the medication that is prescribed by the doctor. Don't wait. When you get up in the morning and you're nauseated, I want you to take the pill right away with a little bit of water. When the nausea goes away, then I want you to start to drink fluids, because when you're nauseated, when you're drinking fluids, it's not a good idea, because drinking fluids makes you more nauseated. So get up in the morning, take your medication for nausea, and then just wait a little bit. If you really have to eat something, you can eat a little bit of dry toast or dry crackers if you're nauseated. Sometimes when you're nauseated, beverages that are too cold or too hot make you more nauseated, so keep things at room temperature. That will help a little bit with the nausea. Another side effect is vomiting. So if you are vomiting, we also want you to take the medication. If it's not helping, nausea or vomiting for more than 24 hours, you need to call the clinic about that. Another common side effect with chemotherapy are mouth sores. So what we want you to do from the day that you start chemotherapy to the day that you finish chemotherapy is we want you to rinse your mouth out with salt water or baking soda. So 1 teaspoon of salt water or baking soda with 3 or 4 ounces of water, rinse and spit. So you brush your teeth as normal. You're going to have breakfast and then you're going to rinse your mouth. You're going to have your lunch and then you're going to rinse your mouth. So 3 or 4 times a day with salt water or the baking soda. No commercial mouthwashes are allowed during chemotherapy because some of them cause more irritation to the gums. Also, no dental work while you're receiving chemotherapy. That also includes cleaning. If the salt water or the baking soda is not effective, you will receive a prescription for Magic mouthwash. So you will call the clinic and we can fill a prescription for Magic mouthwash. And once the sores go away, then you go back to taking the salt water or the baking soda. Common side effect of chemotherapy is diarrhea. If you are having diarrhea, we want you to take Imodium. How we want you to take the Imodium is we want you to take 2 tablets of Imodium initially, followed by 1 tablet after each loose bowel movement. May sound like you're taking a lot of Imodium, but that's the way the Imodium works. So each time you have a loose bowel movement, you take 2 tablets initially, followed by 1 tablet after each loose bowel movement. If the diarrhea does not stop in 24 hours, please call the clinic. When you're having diarrhea, we suggest you follow a brat diet. A brat diet is bananas, plain rice, applesauce, and dry toast, and that should help with the diarrhea. What we want to do is we want to try to avoid constipation. So what we can try to do is we can drink as much fluid, 6 to 8 glasses of fluid can help with the constipation. Increasing your fiber intake, bran, that type of thing will help you prevent constipation. Walking around, moving, will help with constipation as well, because when you're walking around, things will be moving. If you're just sitting in a chair not moving, nothing will really move. So we really want you to walk around. That will help with the constipation. If you are constipated, we want you to use Senokot or Colace. That's usually effective. No suppositories or enemas. Colace and Senokot are usually effective for the constipation. If you haven't had a bowel movement in 3 days, we would like you to call the clinic. Chemotherapy can affect the nerves, and some feelings that you can have is numbness and tingling. Kind of feels like pins and needles. Can affect your fingers or your toes. A little bit of numbness and tingling, pins and needles can occur, but if it's interfering with your activities of daily living, if you can't walk, if you can't do zippers or buttons, then you need to let the clinic know. When you're having numbness and tingling, we want you to be very careful in the home. We want you to have a good pair of shoes on. Be careful with the ice outside if it's winter time. Sometimes your scattered mats in the home, your bath mats, you can remove those because we don't want you to slip and fall. And inspect your fingers and your toes daily if you're having those issues. Chemotherapy affects individuals differently, so we will talk about how chemotherapy could affect your life in different ways. With chemotherapy, when you receive chemotherapy, hair loss usually happens by your next treatment. So usually about 3 weeks following your first treatment is when your hair will start to have thinning and loss. We do have brochures for wigs and scarves, and we do have an information session where you can get some information on hair care. Following chemotherapy, your hair will grow back, and we just avoid coloring your hair while you're receiving chemotherapy and 6 months following chemotherapy. There is a program called the Look Good Feel Better program that is offered to patients. It is a program that is offered the second Wednesday of every month, and it talks about cancer care and how to deal with your side effects. And it is run by the volunteers of the hospital and volunteers who have been through this treatment as well, so they can really help you out and support you as needed. Chemotherapy can affect us emotionally. Sometimes we're a little bit anxious or a little bit depressed. Social workers are available for you. You can always ask your doctor, or you can speak with the nurse for a social work number. Always bring somebody with you for extra support. That'll help you get through things during your treatment. Sexuality is part of who we are. This includes our enthusiasm for living, self-image, and relationships with others, involving physical, psychological, interpersonal, and behavior aspects of a person. Physical changes brought on by cancer treatment may affect our body image and intimacy. Women may experience early menopause, hot flashes, vaginal dryness. Men may experience problems with impotency. These changes can be discussed with your doctor. Common question that people will ask me is, when can I have sex after chemotherapy? Chemotherapy stays in your system for about 24 to 48 hours. So women, we would like to continue with using birth control, and men would use condoms. Just wanted to let you know that smoking does decrease the effectiveness of your chemotherapy. If you do need help with stopping smoking, we have booklets that are available. You can speak with your nurse or your doctor for extra support. While you're receiving chemotherapy, we want you to pay extra attention to your skin. We want you to avoid the sun during peak hours and wear sunscreens. Wide brim hats also is very helpful. No manicures or pedicures while you were receiving chemotherapy, and just be careful when you are cutting your nails to avoid cutting the cuticles. I'm going to give you some general hospital information. The number of the clinic is 905-472-7068. It's a direct number. You will speak with the nurse when you call that number. We're open Monday to Friday from 8 o'clock until 4 o'clock. If you have any questions or concerns, you can phone us. I just wanted to update you on the parking. There are parking passes available for you. It's a yearly pass and it's a 30-use pass. So if you need that, you can go to the booth at the parking department and obtain a pass. On your first day of treatment, you can register at the desk. You bring your health card. Bring a list of your medications that you are on. The nurse will put that in the computer and you only need to bring that for the first day. You can bring in a support person with you. Children under 12 are not allowed to visit the department. The day before treatment, you will get your blood work done. The lab is open from 8 o'clock until 3 o'clock. And you will also see your oncologist the day before treatment. On the day of treatment, we will look at your blood work. You will fill out a questionnaire. And we will decide then, based on your blood work and based on the questionnaire, whether or not you can have treatment that day. And if your treatment is on a Monday, we'd like you to come in on the Friday to have your blood work done. And again, the lab is open from 8 o'clock until 3 o'clock. If you have an access device, a pick or a port, the nurse in the clinic can take the blood out of the access device instead of going to the lab, or you can choose to go to the lab, whichever one you prefer. If the blood work is not within the normal range, you will not receive treatment that day. We will give you a week off, we'll redo the blood the next week, and then we'll see how the blood work is that week. Now we're going to talk about what to do when you go home. Before you leave your clinic, make sure you have your prescriptions, your next appointment, your calendar of appointments, and all your belongings. When you're going home, you probably want to know when you should call me. You should call me if you have a fever of 38, if you're having shortness of breath. If you're having chest pain, obviously you will dial 911. If you're having blood in your urine or blood in your stool, if you're having difficulty voiding, if there's a smell in your urine, you will call me in the clinic. If you are having problems with increased pain, sleeping problems, you can call us in the clinic as well. A good idea might be to buy a large hand sterilizer and put that at your front door. Everyone who walks into the house hand sterilizes their hands, and that should be enough. No one who is sick should be visiting you. So you should police your own front door. We don't want anyone sick entering your home. When you're out in public, we want you to be careful of your environment in public. If someone is coughing, you kind of walk away from them. Be careful when you're in public, when you're using the public facilities. Always carry the hand sterilizer in your pocket. Have a thermometer at home, and remember, if your temperature is 38, you're to call the clinic. Avoid scattered mats, because we don't want you to fall when you're at home. Bath mats, things like that you could trip and fall. A good pair of shoes as well, we mentioned before. When you're at home, wash your vegetables, your fruits and vegetables very, very well. Try not to have newborns, be around newborns, because we don't, or young children, because they're, especially children under 10, they can be very sick at times, so we don't want you to be sick from them. Here are some precautions at home for 48 to 72 hours following your chemotherapy. We would recommend that you flush your toilet twice after each use with the lid down, and men should sit on the toilet when they pass their urine. If your clothes or your linens do become exposed to bodily fluids, we'd like you to wash those clothes separately in hot water twice during the machine. If they are not washed immediately, you can place them in sealed plastic bag. Undergarments such as disposable diapers can be put in plastic bags sealed. Caregivers should wear nitrate gloves while handling bodily fluids such as urine, stool, and vomit. Dispose of gloves after each use and wash your hands. After using any device for bodily waste, patients should thoroughly wash their hands with soap and water. Dry the devices with paper towels and discard the paper towels. Caregivers who accidentally come in contact with bodily fluids should wash the area of exposure several times with soapy water. Your safety is important to us, and you have a role in your safety. Here's some important tips for safety. Bring an updated list of your medication to your appointments. Report symptoms experienced following your last treatment. Report any medical issues since your last visit to the hospital. Call the clinic if you are experiencing any symptoms. And don't forget, wash your hands. The healthcare team at Markham Stouffville Hospital is here to support you. the nurses, the doctors, social workers. If you need to reach us, contact us Monday to Friday from 8 o'clock until 4 o'clock, 905-472-7068. Thank you.